And mindfulness is a powerful tool. It's a resource. It's a skill that we have within us that sometimes we're just not aware of. When someone first hears you have lung cancer, it's quite, I think, traumatic. And there's so many things to consider and so many questions. There's a sense of overwhelm. You know, the thoughts are, why me? Will this end my life? How can I afford this treatment? I just think that there's a lot of things that go on, and it's very, very challenging in that moment. So that start of the lung cancer journey, mindfulness can help people respond versus react. For those undergoing treatment, mindfulness can help with symptom management. It can help manage sleep, pain, nausea, and other symptoms. Mindfulness has been shown to lower blood pressure and decrease cortisol levels. And then those in post-treatment, they actually, have to continue to be followed up. So there's follow-up scans or blood work. And so they have to come into the clinic still. And that's going to be for a long time, maybe for the remainder of their life. But what mainly seems to be an issue with them is their fear of reoccurrence. And those thoughts and those fears, mindfulness can help them face the fears and also not be overwhelmed by that anxiety that is associated with that. I think the first place people actually are aware of mindfulness tools are now there can be, excuse me, apps on the phone that can be downloaded. There's apps called Calm, Headspace, Insight Timer, Smiling Mind, and UCLA Mindful are just a few. There's many, many out there now. And some are free. Some, if you want to go deeper, you have to pay extra on a monthly fee. But UCLA Timer has meditations in English and in Spanish, and I wanted to let people know that. There's magazines that are available too. Mindful is a magazine that I read regularly, but even National Geographic put out an issue about everyday mindfulness. And then there's articles in magazines. The Clinical Journal of Oncology Nursing published an article recently, within a year, about mindfulness and mindful breathing. And so patients who did mindful breathing 3 times a day for 5 minutes were compared to patients who didn't do any mindful breathing. And it was found that the patients with mindful breathing actually handled their stress better and felt less stressed. I also think mindfulness is so important in a daily practice, and I use a book called How to Train a Wild Elephant and Other Adventures in Mindfulness. And that book is by Dr. Jan Chosen Bays. And this gives 52 weeks, one practice a week for a daily basis, so that you can continue to practice mindfulness. And that's the most important thing, is we have to develop our mindfulness muscle. So we have to practice on a daily basis. And then clinicaltrials.gov certainly has mindfulness studies listed. And I want to stress that a lot of cancer support communities are providing mindfulness programs now. I work with one here in my local hospital, and I provide mindfulness classes, and there's mindfulness meditation online. Let's see. I think that's about it for resources, but I really do want to stress that mindfulness in a daily life is so important, and it really can help us connect with the mind, body, and spirit. And mindfulness really contributes to being a healthy survivor and develops our resilience in going through the cancer journey. Thank you.